Tonight, Florida Panthers defenseman Aaron Ekblad had a disastrous fall on his left knee. Let's review the footage and discuss what this could be in more detail. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that average fans can better understand what's going on. Be sure to like and subscribe if you want to stay up to date. For now, let's go back to the footage. So I find hockey footage extremely difficult to report on sometimes just because of the sheer amount of equipment that is worn on a hockey player. So a lot of it, what we think is going on, is really mechanism dependent, and that's what we're thinking when we go on the field or on the ice. So let's look at the play here. Aaron is coming down to clear the puck. And I mean, he's not hit actually pretty severely by the defenseman, which is what we always think about when we think about hockey. You know, he's under this leg here, and this is the leg that he's going to be in a lot of pain in. But if we find out, so he essentially loses his footing, comes down, this skate is going to come out from under him, or actually get stuck there on the edge. And this is the injury that we're worried about. So just watch that knee kind of buckle and go in that way. So there's a few things when we see a mechanism of injury like that. So unfortunately, because he's wearing his pads, we don't see any open bones, bent bones, or anything like that. So it's something we have to be suspicious of, but we won't have the complete information until we take them off the ice into the dressing room. So a few things I wanted to bring your mind up to here. As you notice here, we call this a caving in of the knee, or a valgus force to the knee. Essentially what you do is you open up that side of the knee right here. There's two ligaments here. You have your medial ligament, you have your lateral collateral ligament. So when you fall in and cave in that side of that knee, you're worried about busting that open. So the second thing you have to be worried about is either fractures or dislocations. So if we take a look here, you can either have a fracture of the top bone here, which is your femur, or the bottom articular surface of your tibia. Now, with the way he fell, I'm not really concerned about a femur fracture. It takes a ton of force to fracture that femur. We have to be really worried about this area here, especially the parts that attach within the knee joint itself. So the other thing you have to be worried about is an intra-ligamentous injury, so injuries to ACL or PCL. Now, I mean, this is your traditional plantar twist mechanism, but essentially that ACL and PCL hold the top bone, which is your femur, to your bottom bone so that it doesn't translate forward and backward. Now here, you're seeing that there's excessive hyperflexion, and it's injuries like that where we're worried whether or not one of the ligaments is completely snapped. The other things that you need to be worried about as well are essentially things like patella dislocation. So it's not uncommon, especially when the knee caves in, that this patella can come out this way. I've worn these hockey pads myself, and to be honest, the space within that knee is quite a lot. So I mean, the patella does have, which is your kneecap, has play to move. So when you flex this knee and kind of bring that femur down, for example, you have that mechanism where you may dislocate the knee. And I mean, it's definitely a possibility. With what we saw on the ice, it's difficult to tell whether or not Aaron, if he actually dislocated his knee. I want to show you one other thing that the team did. So if you take a look at the way the rescue team is working, they're actually, because he can't get up, they're going to board him as per safety protocols. But the other thing that they're doing is they're stabilizing that leg. So even though we think, he may have blown out a ligament, for example, the fact that he was in that much pain, he could not get up, he couldn't weight bear and move it. You have to treat it as a potential fracture or dislocation or unstable knee until you can get a better assessment. So this is what they're doing. Once they get into the back end, they're going to essentially take off all of his equipment and likely get some imaging to see what's going on. You want to rule out the bony fractures first, the dislocations, then you have time to decide whether or not they're meniscal injuries or ligamentous injuries, because that's not going to harm him in the acute setting. Once I get more information, I'll make sure to leave a comment down below. If you have any questions or comments, leave them down below. If you like this video and want to stay up to date on more videos I do in the future, please like and subscribe to my channel. For now, that's all.